Okay, listen to this for a second. For seniors, the mortality rate 12 months after suffering a hip fracture is literally 3 to 4 times higher than that of the general age-matched population. Think about that. When we talk about diminishing bone density as we get older, we aren't just talking about a little frailty or inconvenience. We are quite literally talking about a matter of survival. So, welcome to this explainer. Our goal today is to comprehensively cover everything you need to know to build a highly actionable, remarkably effective, and, most importantly, safe master blueprint for aggressive bone density supplementation. We're going to move way beyond the basic just take some calcium and vitamin D advice because, well, it's just not enough. We're exploring the true microarchitecture of skeletal health. Think of your skeleton like a high-rise building. Here's our agenda for mapping out this construction site. We'll start with the blueprint, lay down the foundation, build the framework, introduce the site managers, review the workplace hazards, and finally create your custom master plans. Let's jump right into Section 1, the bone-building blueprint redefining skeletal survival. You know, to build truly strong bones, we absolutely have to look past those standard two-dimensional DXA scans. They often completely underestimate true density, especially in smaller folks or those on certain meds. And that brings us to a much better concept, skeletal survival. This metric isn't just about cramming minerals into a vacuum. It demands a robust environment of substrates, cofactors, and, crucially, muscle mass to prevent you from falling in the first place, especially since so many common medications, like acid blockers and antidepressants, actively induce bone loss. Moving on to Section 2, the foundation, the macro mineral tetrad. Okay, so these 4 essential macro minerals, they absolutely cannot work in isolation. Let's unpack the clinical data here. Calcium is your brick, and your body maxes out at absorbing about 500 milligrams per single dose. Vitamin D3 is the gatekeeper, typically around 2,000 IUs, which essentially opens the gut so you can actually absorb that calcium. Then, vitamin K2 acts as the site foreman, directing the calcium specifically into your bone matrix where it belongs rather than your arteries. And finally, magnesium is the stabilizer for the whole operation. But here's the thing, not all calcium is created equal. Calcium carbonate is super cheap, sure, but it requires really strong stomach acid to dissolve. For seniors, especially those on acid-blocking PPIs, calcium citrate is vastly superior because it doesn't need that highly acidic environment to work. Oh, and we're also seeing some incredible clinical results from novel plant-based marine algae complexes. They provide highly bioavailable calcium right alongside natural trace minerals. It's a real game changer. Now, let's talk about our 2 K2 site foremen, MK4 and MK7. MK4 has an incredibly short half-life. That means to rapidly activate the bone-building protein osteocalcin, it requires massive 45 milligram doses. That's a protocol heavily backed by over 30 years of trials over in Japan. MK7, on the other hand, is transported via LDL cholesterol, which gives it a super long half-life. It works beautifully at microdoses of just 180 to 375 micrograms. Listen, if you take away only one number from this foundation section, let it be this, 2.0 to 2.5 to 1. That is the absolutely critical physiological intake ratio of calcium to magnesium. If your calcium intake drastically exceeds your magnesium, it literally paralyzes your osteoblasts. Those are the cells that actually build your bone. And this is deeply concerning for the roughly 30% of the population carrying a specific gene variant that impairs cellular magnesium and zinc transport. Let's build on that with Section 3, the framework, essential trace minerals. If calcium is the concrete of our building, trace minerals are the flexible steel rebar hidden inside that prevents the whole thing from shattering on impact. Meet your trace architects. Highly bioavailable silicone physically cross-links the collagen scaffold. Then we have boron. Just 3 milligrams of boron significantly extends the systemic biological half-life of estrogen, testosterone, and vitamin D3. It heavily favors bone growth. So the crucial point here is understanding the fierce competitive antagonism between zinc and copper. They are both essential for bone marrow antioxidant defense, but they literally fight for the exact same transporters in your gut. Taking aggressive high-dose zinc, say for your immune system, will rapidly cause a severe copper deficiency, and that completely stops proper collagen cross-linking. They absolutely must be strictly balanced at a 10-to-1 ratio of zinc to copper. All right, moving into Section 4, advanced botanicals and modulators. These aren't just your standard building blocks. We're talking about advanced phytochemicals that send targeted genetic signals to your body, telling it to prioritize bone over fat. For example, Cissus quadrangularis aggressively stimulates the creation of new bone cells. It's heavily utilized for fracture healing. Oleuropein from olive leaf actually halts a postmenopausal shift of stem cells into fat. Genistein acts as a targeted natural estrogen modulator, and dehydrated nopal cactus, it can actually reverse a condition where your kidneys leak massive amounts of calcium into your urine. But hey, I need to give you a severe warning here about a heavy metal often marketed as a bone supplement, strontium. Because strontium is physically heavier than calcium, it artificially inflates DXA scan readings. It creates this total illusion of massive bone density gains. But high-dose strontium carries severe risks of blood clots and heart attacks. Honestly, it is a dangerous, unsupervised intervention that should be entirely avoided by anyone with cardiovascular risks. Which perfectly transitions us to Section 5, Critical Hazards and Interactions. This is the most critical section of our explainer, the workplace hazards. These potent supplements frequently and dangerously clash with conventional pharmaceuticals. Let me be absolutely crystal clear on this. Mixing vitamin K2 with warfarin results in a lethal risk of severe blood clots. Taking modern blood thinners with ginseng alters plasma levels, risking massive hemorrhage. And if you take calcium at the exact same time as your osteoporosis or thyroid medication, it physically binds the drugs in your gut, rendering them completely useless. You have to space them out. And it's not just drugs. Even the most chemically pristine supplements will totally fail if you take them alongside a bowl of wheat bran or a raw spinach smoothie. Why? Because they contain phytates and oxalates that aggressively bind to minerals, just flushing them straight out of your system. Similarly, high sodium and caffeine force your kidneys to aggressively flush calcium out of your body. And a huge warning, if you have advanced chronic kidney disease, standard high-dose vitamin D3 and magnesium can rapidly cause lethal vascular calcification. Nephrologist supervision is 100% mandatory there. Okay, let's bring it all together in Section 6, Building Your Custom Regimen. Because a one-size-fits-all approach is a complete myth, we have to combine all this data into actionable daily regimens. Master Plan A is foundation repletion. This is the optimal default for seniors with falling density but no severe fractures yet. The goal here is simple, filling biological deficits. You replete D3, hit 1,200 milligrams of combined calcium from food and pills, add your magnesium, and ensure adequate protein. Megadosing beyond this, it just adds toxicity, not structural benefit. Now, Master Plan B is the sarcopenia first regimen. For frail seniors with a slow gait or recent falls, the best bone regimen is actually a muscle regimen. The focus shifts heavily to protein, up to 1.5 grams per kilogram of body weight, ensuring 3 grams of the amino acid leucine per meal, 5 grams of creatine monohydrate, and rigorous progressive resistance training. You have to build the muscle to prevent the impact of the fall that shatters the bone in the first place. Master Plan C is for postmenopausal women who are declining prescription hormone therapy. You start with that foundation stack, but then aggressively target cellular signaling by adding 54 milligrams of genistein or maybe 100 milligrams of oleuropein. These highly targeted phytotherapeutics offer a bone protective effect by mimicking estrogen signaling locally right in the skeleton. But, crucial caveat, the patient must lack estrogen-sensitive cancer risks. As we wrap up, I need to summarize the core ethos of clinical geriatrics. If your fracture risk is critically high, your supplemental protocol must act as the supportive framework for advanced prescription agents. Supplements absolutely optimize the environment, but they cannot replace the massive fracture risk reduction achieved by prescription drugs in severe osteoporosis. They are a team, not competitors. I want to leave you with this provocative question to chew on. Are your supplements actually building your bones, or are they just fighting your medications? I highly urge you to audit your pill organizers today. Ensure your calcium, your K2, and your exquisitely balanced trace minerals are perfectly sequenced. Because, as we've seen, true skeletal survival isn't an accident. It requires a precise, aggressively managed master blueprint.